So, OP poisoning is a very important case that comes in most of the Indian exams. And how to atropinize a patient, what are the endpoints of atropinization, or how do we give atropine in a patient with OP poisoning is a question which many students fumble with. And I also fumbled here. So, what are the endpoints of atropinization? So, if we go to the initial days when OP poisoning was getting treated and when critical care was not very developed, at that time the targets of atropinization were mainly pupils. So, it was clear that the targets or the endpoints of atropinization will be a fully dilated pupil, having a completely dry skin to the point of having dry axillae, to have a heart rate of up to 150 and have completely absent bowel sounds or maybe a occasional bowel sound heard. So, these were the endpoints of atropinization, and these endpoints led to very high doses of atropine being used, and when so high doses of atropine were used, it led to a lot of toxicity including arrhythmias and neurological toxicities and hyperpyrexia, which could lead to intolerance of this atropine or even increased mortality due to OP poisoning. As the decades passed and the understanding of OP increased, the targets of or the endpoints of atropinization changed, and now the three targets of atropinization are having completely a clear chest, having a systolic blood pressure more than 90 millimeters of mercury, and having a heart rate of more than 100 beats per minute on day 1, 90 beats per minute on day 2, and 80 beats per minute on day 3. Why the heart rate is a little higher on day 1 is because there could be a possibility of enterohepatic circulation of the OP compound, and the heart rate, and if there is more circulation, the heart rate may suddenly drop, and that is the reason why it is important to keep a little higher or a safer zone of a higher heart rate on day 1 and gradually decrease the targets. So, if we keep targeting pupils as our endpoint, then the toxicity of atropine increases significantly and they are not considered as a endpoint of atropinization. So, you should not really look at the pupils. Even if your pupils are small or mid dilated, they are fine. Your target is to maintain a as I discussed, it is to maintain a completely clear chest because hypoxia is life threatening, to have a heart rate more than 100 on day 1 because bradycardia should be avoided, and lastly to keep a systolic blood pressure more than 90 millimeters of mercury. So, these are the three important endpoints, and this is the precisely what should be said. If you have any other question which confuses you practically or theoretically, please free to write it down in the comments and I would put a short video on it. Best wishes.